Okay, guys, can you hear me now? All right, awesome. So let's start over, guys. So I want you guys to go ahead and read the disclaimers. Take a look at the disclaimers. All right, awesome. All right. So these are the disclaimers, guys. All right. And this is the disclaimer. All right. So you guys are going to read the disclaimers. And also just keep in mind, guys, that tonight you guys will find that the lectures align with your leadership books, with your leadership supplemental books. So this tonight is maintaining a safe airborne, maintaining a safe environment. So as nurses, guys, remember we have to maintain a safe environment in all aspects. So just keep in mind that tonight's lecture is maintaining a safe environment, and you'll find that that means a lot. That means that we cover so many different areas. Okay, so just keep in mind you can use these notes with your books. It aligns pretty good. I do a lot of research for other resources, but I think you'll like it with your textbooks and your supplemental resources as well. Okay. Just keep in mind, maintaining a safe environment is the same in Florida, Wisconsin, Texas. This is how we maintain a safe environment. So you'll be safe with this lecture. All right. All right. So the first thing, guys, is airborne precaution. Okay. One way that we can maintain a safe environment is airborne precautions. So remember, we all know MTV. All right. Remember measles, TB, varicella in a private room. So this is the rationale behind the private room. Okay. You have to have a private room because a private room comes with negative pressure with 6 to 12 air exchanges. Okay. This air exchange, the discharge goes outdoors. All right. So 6 to 12. So this is very important. So the bacteria doesn't travel throughout the hospital. All right. Make sure that your patient has you and every visitor has an N95 mask. Now, I've noticed that they're throwing in this HIPAA filtration before air is recirculated. This is also a requirement. If a facility doesn't have that monitored negative air pressure room, they have to have this HIPAA filtration. Okay, it's like a little machine, but it pretty much does the exact same thing. Okay, so it either has to be a monitored negative air pressure, HIPAA filtration before air is recirculated. This is how we keep the air, or this is how we keep the hospital free of TB. We don't want the entire hospital to get or contract tuberculosis. So make sure that your patient is under these airborne precautions. All right. And this is just a rationale, guys. All right. Okay. So the next thing, guys, that we're going to discuss, common medical and medication errors. All right. In order for us to maintain a safe environment, guys, remember safety comes with making sure the patient is getting the correct medication, and safety comes with not having these surgical errors, these healthcare acquired infections, nosocomial infections, making sure that you give a good end of shift report, and your SBAR report needs to be accurate as well. This is how we maintain a safe environment overall, holistically. Like we give mind, body, and soul type of care. So, in order for us to maintain a safe environment, make sure that you are aware of there's such thing as diagnostic errors. So, check to see if the diagnosis aligns with the diagnostic procedure. If I have a patient that's in the hospital for a splinter, I'm going to question the order. Why is this guy going down for a cardiac cath? Or if I have a patient who has issues with their cardiovascular system, why are they going down to GI procedure? So diagnostic errors, all right? Surgical errors, guys, they have to do a timeout. Okay, it's required that they do a timeout in the OR to ensure that these patients aren't having surgical errors. Healthcare acquired infections. So I really want to focus on this. Healthcare acquired infections. This is the reason why we have to make sure our contact patients are with our contact patients. Our TB patients are with TB patients. Okay? Or our droplet precautions are with droplet precaution patients. Guys, because we don't need everyone in the hospital getting these healthcare acquired infections. They also call them nosocomial infections. But now they're going toward healthcare acquired infections because they want people to know, listen, I got this when I was in the hospital. Okay, so in order for us to maintain a safe environment, make sure that you understand that all of these things have to be avoided. Diagnostic errors, surgical errors, healthcare acquired infections, end of shift report, and the SBAR report, guys. If someone does not give you a proper SBAR report or end of shift report, listen, you have the right to say, listen, it is my responsibility to maintain a safe environment, and you didn't give me an adequate report. Okay, that's how you justify, going to the charge nurse and complaining on that nurse. All right, so maintaining a safe environment. Now the next slide is QSEN. All right, it's called QSEN. I know you guys have heard of it. Most schools, they put QSEN initiatives all over the walls so students will understand QSEN is a big deal. Okay, quality and safe education for nurses, patient-centered care. We have to teamwork. We have to work with other team members. We have to collaborate with other healthcare providers. Evidence-based practice, guys. We don't experiment on patients. Quality improvement. From day one, you need to be involved in quality improvement. This is how you get your raises. This is how you grow. Safety. Remember, we're trying to maintain a safe environment. And informatics, charting. Okay? In order for someone to get these magnet hospital recognition, guys, they have to have high scores in QSEN. QSEN initiatives have to be prevalent throughout the facility. All right. So this initiative was funded by Robert Wood Johnson Foundation because they wanted to include the fundamentals of patient safety and quality improvement into the professional practice of nursing. So this is a big deal. Patient-centered care, teamwork, evidence-based. This is a huge deal in nursing. So make sure that you understand QSEN, QSEN, QSEN initiatives. All right. It's a big deal. It's been around since 2005 and it just continues to grow. So that's why when you go to the nursing schools, you see the posters everywhere. Okay, so QSEN. All right. QSEN. KSA. QSEN. KSA. Knowledge, skills, and attitudes, guys. A nurse is expected to know why. A nurse is expected to know how. And a nurse is expected, guys, to have a very good attitude, a healing attitude. A nurse has to want to have the attitude to provide holistic care. All right. So you have to be knowledgeable. You have to know your skills and you have to have an attitude, a good attitude, one that promotes healing, one that promotes professionalism. So KSA is a big deal. All right. So just keep in mind, we're talking about how to keep a safe environment. So if you don't know your stuff, if you're not knowledgeable, if you're not skillful, if you don't have the right attitude, guess what? You're not going to have a safe environment. All right. Handling infectious and hazardous material. Guess what? This is also maintaining a safe environment. All right. So I wanted to add a picture, but I didn't want to get a copyright strike. But guys, infectious and hazardous material, I can't say enough about it. All right. Because remember, we're in a hospital, we're working in a facility where people are not well. All right. So we have to be very careful with these needles, soiled equipment, soiled linen, medical waste disposal. All right. So we have to be very, very careful when handling infectious and hazardous materials, guys. Okay. So in order for us to keep a safe environment, when you guys start working, make sure that you know exactly how to get rid of the used needles. And what do? We put them in a sharps container. Soiled equipment, you call environmental. Don't let someone come behind you and use equipment that's soiled. Soiled linen. How do I get rid of soiled linen? Or what do I do with soiled linen? So all of these things, guys, are what we have to think about when we are keeping a safe environment as a nurse. All right. So handling infectious and hazardous materials, sharps, guys. Biohazards include, make sure you remember this. This is that red bag. All right. This is why you see the red bag around the hospital. Infectious waste, blood products, IV tubing, cultures, contaminated PPE. Okay. They have to dispose of this a certain way. So biohazards is a big deal in the hospital because they don't want nurses throwing needles in the trash can, infectious waste in the trash can. Okay. It's a certain place that you have to put it. All right. And when you get your orientation to your facility, they'll say, hey, this room is for biohazards and everything has its own container. All right. So just make sure you keep that in mind. This is also how we maintain a safe environment. All right. So the next slide is about, of course, black containers. All right. This is the black container, and this you'll see these in the hospital as well. All right. It's called Resource Conservation and Recovery Act. That's the RCRA, Resource Conservation and Recovery Act. Basically, they want to make sure that we're using these, we're putting those hazardous medications, those half partial doses, those hazardous bulk meds, and bulk chemo in the black container because they're going to dispose of these chemo medications, these very strong toxic medications, a lot differently than they would dispose of just a medication that we can just kind of just open the package and throw it in the trash. All right. So maintaining a safe environment involves Resource Conservation and Recovery Act. So these medications have to go into a black container. So they're hazardous medication. That's the first bullet I put there, hazardous. So keep that in mind. All right. Have a partial doses. So sometimes if you don't have to use the entire dose, you may use a partial dose. The other half goes into the container. Hazardous bulk meds and bulk chemo, guys. So this is when you'll see the black container. Okay. All right. So make sure that you guys understand there's so many parts to maintaining a safe environment. All right. One of the most important, guys, for you as a nurse is sequence for putting on PPE. All right. This is how you maintain a safe environment, guys. So what you want to do is hand hygiene, especially if someone has contact precautions, TB precautions, droplet precautions, hand hygiene, gown, mask and respirator, protective eyewear, and then the gloves. So this is a sequence for putting on the PPE. Hand hygiene, gown, mask, protective eyewear, gloves. So the individuals that are working with patients who are COVID-19, guys, this is their norm. All right. Now removing, sequence for removing the PPE. remove the gloves, protective eyewear or face shield, gown, mask, or respirator. All right. So remember the sequence also, this is how we maintain a safe environment. This is very important for us and the patient. All right. So our next slide, just make sure you guys write that down, go over that so many times so you don't forget the sequence for removing PPE, because we tend to forget that one. All right, so accident and injury prevention, maintaining a safe environment. All right, so we have to educate and we have to make sure that we know about fall precautions and bleeding precautions. So guys, if you have a new patient and you've just met this patient and the patient doesn't seem, well, the patient is not alert and oriented times 4, do orthostatic blood pressures, guys. All right, that will tell you a lot. All right, monitor blood glucose and adequate dehydration or adequate hydration. I'm sorry, that's adequate hydration. Make sure that you are doing orthostatic blood pressures, monitoring the blood glucose, because somebody blood glucose is very low. Believe me, they may fall as they get out of bed. And if someone is dehydrated, guys, it does cause orthostatic hypotension as well. So fall precautions, this is some way that you and I as nurses, and we don't need orders for this, to make sure that our patient does not fall. All right. And bleeding precautions, guys, make sure that you are educating your patient about bleeding precautions. So that's an electric razor. All right. Protect the patient from injury. So allow them and let them know, listen, you're at risk for bleeding, so you can't do these things that you normally do. You need to call me before you get out of bed. All right. So accident and injury prevention again. Restraint. So we're going to talk a lot about restraints tonight. All right. Very important. Restraints, restraint. So this, make sure you put this in red. Make sure you highlight restraints, because restraints can be, they're going to talk to you about restraints. They're going to question you about restraints, because restraints can cause a lot of problems for everyone in the facility and the patient. All right. Most important, the patient. All right. So restraints, observe as often as possible, but document every 15 minutes. Guys, there's no limit to the amount of times I can look at my patient when they have restraints. There's no limit, but I must document every 15 minutes, and I must remove and assess every 2 hours. So if you get a question and they're asking you, how often should you assess the patient? You should assess the patient as much as you can, as time will permit. But I need to document every 15 minutes, and I know I need to remove and do neurosensory checks every 2 hours. Okay, so that's somewhat that, a little trick that I see on some of the questions when I'm reading some of the questions about restraints. So when you remove and assess every 2 hours, you're checking for pain, pulse, pallor, paresthesia, and paralysis. So this is our goal. We check, we remove the restraint, and we're checking for these 5 Ps. All right. This is how we maintain a safe environment for that patient that must have restraints. And we're going to talk about restraints a lot. All right. So just make sure you put restraints in red. All right. So home safety. All right. Home safety. Also, guys, believe it or not, some of us are going to be community nurses. Some of us are going to be home health nurses. You may be a nurse practitioner visiting the home. Home safety. Make sure the home is clean and free of clutter. Ease of access, guys. Make sure the patient can get to the phone if he has an emergency. Know the exit plan. Examine the alarms and the fire detectors, guys. Clear medication labels. All right. And this is a big one. Number 6 is a big one, guys, because it kind of threw me off too. Mark cold and hot faucets. And it should be no more than 120 degrees Fahrenheit. All right. And to me, I thought that was very hot, but that's the norm. That's okay. 120 degrees is okay. Anything more than that, that's bad. So we have to make sure that home safety, that we are educating the patient, especially when it comes to the hot water. The hot water heaters, it should be 120 degrees Fahrenheit. Okay. Not more than that. All right. So the next thing that we can do, guys, also is ergonomic principles. All right. This can help maintain a safe environment for you, for the nurse, and the patient. All right. So one thing that we have to know, use a Hoyer lift, team lifting. Don't use your back or your legs. All right. It's like they say your strength is in your on your legs. Like if you use your legs, you'll find the strength. They want you to use your legs, but it's almost like you have to use your core as well. So don't use your back, use your legs. Assist, don't lift a patient, guys. Don't ever feel like you have to lift a patient on your own, and don't lift from the waist. So be very, very careful with their these principles, guys. All right. This is one way that we also can maintain a safe environment, not only for the patient, but also for yourself. All right. So reporting. How do we maintain a safe environment? We report. If we see something wrong, guys, you must report it. If you witness an error, report it. If you see defective equipment, report it. Report all incidents immediately, guys. So use your chain of command, which is the charge nurse, and then you'll go to the supervisor, the nursing supervisor, okay, or the nurse manager. All right. Report all incidents immediately. All right. Keep that in mind. All right. And the next event or the next issue is sentinel events. All right. Maintaining a safe environment. So there should be absolutely no sentinel events. All right. No sentinel events. So a medication error could be a sentinel event. Surgery, guys, operating on someone's removing the wrong extremity. That's a sentinel event. Suicide is a sentinel event. Delayed treatment, falls, and restraints. Death from restraint, that's a sentinel event. So we have to make sure that we are very aware of that. All right. So this is normally, make sure this is your priority as a nurse. All right. Because sentinel events, guys, there's no excuse for them. All right. They want you as a nurse to understand, like, these are sentinel events. This is unexcusable. So no medication errors, guys, no surgery, no wrong site injuries, no suicide, don't delay treatment, and check for falls, and always assess your patient who has restraints. All right. Also, death, physical injury, loss of limb or function, suicide, rape, infant death, and infant discharge to wrong parents. All of these are sentinel events. There is no excuse for them. Okay, as a nurse, we have to try to prevent these things. This is how we maintain a safe environment. Okay, so the next issue is safety issues. All right, maintaining a safe environment. Safety issues, guys. So there's a lot of nurses that fail to rescue. There's a lot of nurses that fail to plan. So they don't do the assessments, they don't have treatment, and they don't make their goals. So this becomes like a failure to rescue. And this is a major issue. This is a safety issue. And so we try to make sure these things don't happen, because we do rounding, hourly rounding, and we make sure that our S-bar is effective whenever we're talking to anyone. All right. Make sure that your S-bar is effective. That's your situation, your background, your assessment, and your recommendation. The problem is, guys, with failure to rescue, failure to communicate, is that the assessment isn't done in a timely manner. Okay. So this is not a safe environment. So this is something that we're trying to prevent. So make sure that you're doing your rounding. Make sure that you're doing a proper assessment. Make sure that you are rescuing your patient before the patient progresses to deteriorates. All right. So failure to rescue, failure to communicate. That's a big issue for us as nurses. So these are a couple of things, guys. These are some suggestions, or these are some conditions that always take place. These are prevalent in the healthcare on the floor. So make sure that you guys are aware of them. Failure to recognize deteriorating patient conditions. So that's sepsis, guys. This is our patient that's septic. We don't acknowledge it. We don't assess it. Heart rate greater than 140 minutes per hour. I'm sorry, 140 beats per minute, not hour, guys. 140 beats per minute. Remember that, not hour, okay? 140 beats per minute. All right. That's someone who's sinus tach, guys. If their heart rate is 140, guys, you need to let somebody know right away. All right. And respiratory rate greater than 28, okay, per minute. So when you're there and you're assessing the respiratory rate, is greater than 28. All right, you need to let someone know. O2, less than 90%, guys. So if you see these things, acute changes in mental status, that means that when you met the patient was alert and oriented times 4, and now the patient is alert and oriented times 2. Okay, acute change in mental status. And make sure you remember this one. Urine output less than 30 mLs an hour. So guys, these are not good signs. So if I know a patient is heart rate is greater than 140, respiration rate greater than 28, that's an automatic for me, rapid response. Okay, there's nothing else I can do for this patient. If the vital signs are this way, I know my patient is bottoming out. So I need to let someone know right away. And a lot of nurses don't. This is not a safe environment, guys. You're not maintaining a safe environment. You're not alerting the proper physicians. You're not giving the patient a chance. So you're there to monitor the patient. And if you just allow a patient to be on the floor with 140 heart rate, okay, that's failure to recognize deteriorating patient conditions. All right, that's not a safe environment. All right, so make sure this slide is very important, guys. Even when you guys are in the field, if you see any of these vital signs, if you see any of these conditions, get help right away. Okay, now we're back to QSEN competencies. All right, remember QSEN, patient-centered care, teamwork and collaboration, evidence-based practice, because we do not experiment on patients, quality improvement, safety, and informatics. Okay, so make sure you guys understand QSEN competencies, guys. This is one way that we maintain a safe environment. These hospitals that have these magnet recognitions, guys, believe me, they have the QSEN initiatives, the competencies on locked. They know them, okay? They implement them. Infectious waste, remembers liquid, sharps, solids, chemically contaminated infectious sharps. Remember, they go to a certain place. You know, they are not to be disposed in the trash. All right, they have a designated area. Make sure that you know what area to put these particular infectious waste and hazardous material in. All right, that's a part of our responsibility. Infection control, guys, a big thing. We have to know the difference between contact isolation precaution, droplet isolation precaution, airborne isolation precaution, and neutropenic and radiation procedures. All right. So neutropenic, remember, no fresh flowers. The patient shouldn't be drinking water that has been sitting on a table. You know, it has to be with a lid. We have to consistently check the labs. All right. The WBCs. All right. So limit the visitors. No one should visit the patient if the patient is sick. Okay. Things like that. So infection control. It is our job to educate everyone that comes into the facility. It is our job to educate the patient. So make sure you know the difference between when a patient has to go to a contact isolation precaution, droplet, airborne, neutropenic. So this is a very important slide because it kind of breaks down and it tells you, okay, if you have a patient and the patient has lice, you know what area or what precaution for that patient. And look at MRSA. MRSA is there. Okay. Influenza is there. Chickenpox, shingles. All right. Neutropenic and radiation procedures. All right. So these are all infection control. This is how we keep the environment safe, guys. As nurses, it is our responsibility. All right. Now we're going to talk about latex-free environment. Okay, guys. Some people, they cannot touch latex. They can't have the procedure with latex, guys. It causes a very bad allergic reaction. So we have to make sure that we assess that and monitor that. So we have to have non-latex gloves, latex-free environment. They may have to have these nitrile gloves or these vinyl gloves, guys. Okay, so it has to be a latex-free environment for the patient. That's how we maintain a safe environment for that patient. And these are just some associations like between latex allergy and fruit allergies. So these are some frequently involved foods. So if a patient is allergic to these fruits, then you may want to be very cautious or assess the patient to make sure that they're not allergic to latex as well. All right. So that's like kiwi, banana, peach, avocado, chestnut, and fig. Okay. So if a patient is allergic to these, sometimes they are allergic to latex as well. So this is something as a nurse that you just need to be aware of. A patient tells you, yeah, I'm allergic to figs. You should say, are you allergic to latex as well? Do you know if you're allergic to latex as well? The patient may say, I'm allergic to chestnuts. Oh, are you allergic to latex as well? Have you had any reactions to latex? Oh, I'm allergic to avocado. Are you allergic to latex as well? Have you had any reactions to latex in the past? So these are some fruits that are involved. Usually, if a patient is allergic to the fruit, then it's a high chance that they may be allergic to latex as well. All right, so infection control, guys, remember, use the safety needles appropriately. All right, and sharps container. When the container is 3/4 full, put on the lid, call environmental. All right, some facilities, they want you to tape it up. You know, they'll just tell you to tape it, but 3/4 full, don't put anything else in the container, tape it, or call environmental so someone can remove it. All right, it's a part of our responsibility. Okay, the reason why we tape it at 3/4 full, because we don't want to get any needle stick injuries. We don't want any of the patients, we don't want the family members. If you do get a needle stick injury, bleed it, clean it, cover it, report it, call for help, get tested, ID source patient, and get follow-up exams. So bleed it is just like, make it bleed, wash it, clean it, cover it, report it, call for help, get tested. ID source patient, meaning you need to make sure that that patient does not have HIV or any type of infectious diseases before the patient is discharged, and get follow-up exam. So this is one of the reasons why, guys, we try to keep a safe environment when it comes to those, sharps containers, because we don't want someone to suffer from a needle stick injury. All right, so just remember that routine if you do have a needle stick injury or you get a question about a needle stick injury. All right. So nurses, hazardous material. Nurses should adhere to OSHA, guys. You have to have a designated hazmat response team, and always have your safety data sheet. Should be readily available just in case there is some type of hazmat spill or some type of hazmat emergency. All right. That's one way that we keep the environment safe as well. It's our responsibility. So you have to know it. Safe equipment. All right. Make sure that you are using safe equipment. Make sure your environment is full of safe equipment. Okay. So that's a 3-prong plug. Make sure the outlet is grounded. Unplugging equipment using the plug. Don't just snatch it out. All right. Crash carts should be plugged in, and they have to be powered by a backup generator. And do not use frayed cords. Report them immediately. Okay. So make sure that you guys are adhering to this safe equipment rules and regulation, guys, because this is one way, as nurses, is our responsibility. This is one way that we keep a safe environment. Also, next thing is high risk patients for injury. So, of course, children are at risk for injury. Of course, our elderly, our immobile patients, our patients that have cognitive deficits, a labile patient, that's a patient that may be manic or up and down, depressed, anxious, risky behaviors, and a patient who is suicide risk. These are high risk patients. So to keep them safe and from injury, we try to do everything. We try to do every safety nursing intervention to make sure that these patients are safe. We have to identify it and then make sure that they're safe, because they are high risk patients for injury. Okay. So that's just how it goes, guys. These are our high risk patients for injury. So if I see these patients, I know these patients are going to be at risk for falls, or at risk for this, or at risk for that, because these are our high risk patients. All right. So these are our high risk patients for falls, age, children, or elderly. Right. Patients who have issues with mobility. All right. So you're using a walker or a crutch or a cane. Impaired balance, dyspnea on exertion, decreased hearing and visual acuity. So these are our patients that we acknowledge, we assess, we know that they are high risk for falls. And one way that we can confirm it and justify our high risk for fall patients is we'll use the Morse fall scale. And make sure you guys remember this: greater high risk greater than or equal to 51. So you guys may want to Google. I wanted to put it here, but I just didn't want to do any copyright issues. So make sure that you Google the Morse fall scale. Okay, it's something that is going to be, you have to use for every patient, because it's one way that we identify patients that are high risk for falls. Because remember, falls are sentinel events. So this is embedded in your charting to make sure that we protect these patients that are at risk for falls. So how do we prevent falls? Prevention of falls. As nurses, how do we keep a safe environment, not only in the hospital, but also in the community? We promote annual checkups. Okay. Exercise, guys. Believe it or not, exercise increases balance and coordination. And if the patient is at home, the bathroom, install grab bars, use rubber mats on the bathroom floors. And the bedroom, believe it or not, guys, I want you guys to remember this, because this is a question that they always like to throw out there at you guys. Bedroom lamps, lamp near your bed. Okay, a lamp near your bed, or a night light. That keeps that's a prevention of falls. So when you get up, the room is already, it has light, so you don't fall or trip over something. So that's a question that they love to put on the exams about this lamp near your bed, or even, guys, a night light. Okay. All right. So some things as nurses, nursing interventions, this is what we can do to prevent falls in the facility as well, because remember, falls is a sentinel event. So all of these things, you can place the client near the nursing station, imperative items near patient on the bedside table. So that's his water pitcher, his phone, his remote. Put it next to him on the bedside table so he doesn't have to get out of bed. Okay. Put the bed in the lowest position. Make sure the call bell is within reach. Make sure the patient has on yellow non-skid socks, a clutter-free environment, and bed alarm and chair alarm. So these are some nursing interventions that we do in the facility to prevent falls. Okay. Now we also have patients that have seizures. Okay. So how do we keep this patient safe? How do we make sure this patient is in a safe environment? Well, you can put this patient near the nurse's station. Always, guys, if a patient is a seizure precaution, he needs a peripheral IV. Okay, I want you to remember that. Okay, peripheral IV. All right, oxygenation needs to be set up. Suction needs to be set up. Padded bed rails, bed in lowest position, and educate the patient. This is how we keep this patient safe. This is an environment that is safe for a patient who has history of seizures. Okay, remember that, guys, peripheral IV, because rescue medications as IV. Remember, if someone is having a seizure, we can't put anything in his or her mouth, so that patient needs an IV. Okay, oxygenation needs to be set up. Suction needs to be set up. And pad the bed rails. Bed needs to be in the lowest position, and make sure that you are educating the patient, talking to the patient. Okay, because sometimes patients see they'll have an aura before a seizure begins. So let the patient know to alert you when they experience an aura. Okay. So this is how we keep the environment safe for our patients who are seizure precautions. And now, guys, our favorite, restraints. All right. So restraints. All right. Restraint, safety precaution, guys. Okay. Seclusion, physical restraints, chemical restraints, guys. This is for a client, and I want you to remember this. It has to be for a client at risk for injuring themselves or others. Okay, we can't use any of these seclusion, physical restraints, chemical restraints for our convenience, for the nurse's convenience. The patient, the client has to be at risk for injuring themselves or others. Okay, in order for us to truly justify the restraint. Okay. Now, for the restraint, there's different types of restraints. There's an array of restraints. All right. But we must use the least invasive. All right. We have to prevent injuries. We have to prevent aspiration. Okay. And it has to be a doctor order. It must be a physician's order. Okay. So use the least invasive, prevent pressure injuries, guys, prevent aspiration, and it has to be a doctor's order. So remember that about restraints, because remember, restraint injury is a sentinel event. Okay? If someone dies in a restraint, that's a sentinel event. Okay. So different types of restraint awareness. Okay. So there's physical. That's when you physically restrain someone, like you block the patient from leaving out of the room. Chemical, that's a medication. An order is required. Or it can be environmental. That's when you seclude someone. Order is required. And documentation is definitely required, guys. Okay? If you're going to use any of these restraints, make sure that you are documenting. Make sure that you have an order. Make sure everyone is aware. Okay. So the restraint should be selected to reduce client's movement only as much as necessary. So the least restrictive, all right, should be selected to reduce client's movement only as much as necessary. Nurse should explain type of restraint. Should not interfere with treatment. That's a biggie. That's a biggie, guys. Should not interfere with treatment. And bony prominence should be padded before applying. That's how we prevent any type of pressure ulcer. Bony prominence should be padded before you put on that restraint. All right. This is how we protect the patient. All right. Now, documentation. If you have the doctor's orders, the patient is a threat to himself or others, you have the proper restraint. This is what you have to document. You have to document the indication. Why? Patient is at risk of harm to himself and others. Okay. The type of restraint. Is it a chemical, physical, environmental? The location. Is it an ankle, wrist restraint, date and time the restraint was applied, and date and time the restraint was discontinued. Okay, these are the documentation that comes along with the restraint. Because remember, if someone dies with a restraint, that's a sentinel event. Okay, so these are all the different restraint types. But remember, use the least invasive, the one that doesn't restrict movement as much, as needed. Just don't go straight to the vest restraint. Okay, because there's belts, there's jackets, there's wrists, there's hand and ankle, there's other institutional restraints, there's restraint alternatives, there's a double posy double security mitt. So you have to be very aware of the type of restraints your facility uses, but use the least restrictive. Okay, make sure that you use the least restrictive. And it must be a physician order. Remember that. Okay. And restraints, nursing interventions. So this is important. Harmful to themselves or others. Then the restraint applied prior to consulting the provider. Now that's a biggie. Okay. That's a biggie. I read it. It's the truth. I read it. Okay. I can justify it. Restraint applied prior to consulting the provider if the patient is harmful to themselves or others. And you must conduct your neurosensory checks every 2 hours for this patient. All right. Now, if the patient is not harmful to themselves or other, you have to obtain a prescription for the restraint before you apply the restraint. Now, there's a difference. So I'm going to let you read that again because you see there's a difference there. Okay, there's a difference. All right. Restraint applied prior to consulting the provider. Obtain a prescription for the restraint before. Okay, if the patient's not harmful to themselves or others, why are you putting on the restraint before you get a physician order? Okay. Conduct neurosensory checks every 2 hours. All right. That's neurosensory check every 2 hours. You document every 15 minutes. But guys, you can check on the patient every minute. There's no limit or there's no max to how many times you can check on the patient. But guaranteed, you must document every 15 minutes and you must remove and you must do your neurosensory assessment every 2 hours. Okay? So don't get that confused. All right. Now, this is a bit confusing, but I'm just going to it was there. I researched it, so it was there. So I'm just going to give it to you. All right. Restraint, prescription limitation, and restriction. So these are the restrictions. So it should be for an adult, it should be no more than 8 hours. For a child or for a client age 8 through 17, 2 hours. And for someone that's less than 9, 1 hour. So these are the rules. These are the prescription limitations and restrictions, guys. So you got to read that one over and over because they may apply that. They may put that in a scenario for you. All right. Now let's do a review of the restraints, okay? Because it's such a big deal. Restraining limbs, guys. So a physical that may be like 4 people holding someone down to provide care. Restraining limbs, guys, that's a physical restraint. Just, 4 people holding the patient down to provide care. That's a physical restraint. Mechanical restraint. Okay. That's limb, waist, and trunk restraint. A back fastening seatbelt. Full bedside rails when you have all 4. And chair with a locking table. That's considered a mechanical restraint, guys. So you have to document and justify that. You need an order for those things. All right. So don't get it confused. All right. And an environmental restraint. Now look at an environmental, guys. These are environmental restraints. So sometimes you'll go to a lock unit and you know how they have that bell that goes off, that alarm that goes off, the Wonder Guard. That's a restraint. Secure units. Those are restraints. Those lock units. Those patients have orders to be in those units. have doors, barricades, and seclusion. So make sure that you understand these are actually restraints and they require orders. You have to have an order to put somebody in the lock unit. Okay. Now, pharmacologic restraints. These are our chemical pharmacologic restraints. And guys, we just can't use these things for our convenience. So if they are on the MAR, if they are on the medication administration record, guys, you have to justify this. Is a patient having psychotic behavior? If they're having psychotic behavior, then I can use an antipsychotic. Is the patient depressed? If the patient is depressed, I can use an antidepressant. Okay. Now the Versed is something. I put a little note here. It says moments not remembered. You'll normally see this when you have patients who are withdrawing from alcohol and they have to sedate them. So this is when you'll see the Versed is used. And you have your benzodiazepine. All right. So if you're going to use your chemical restraints, guys, you have to justify. Okay. If a patient is anxious, you can't give that patient an antipsychotic. The medication has to match the behavior. All right. The medication must match the behavior. All right. So violent or self-destructive behavior restraints they want to limit it to 4 hours for violent or self-destructive behavior. The rationale would be by 4 hours they should be calm. Some nursing interventions or a doctor's orders should have some type of treatment. It shouldn't take longer than 4 hours to calm someone down. So they don't want the patient in the restraint any longer than that. Otherwise, the treatment needs to change, the treatment option. And providers can renew. That's can renew. All right. I don't know why I put CNA, but providers can renew. So just remember a maximum of 24 consecutive hours. All right. Maximum of 24. So that's a can. That's a big deal, guys. That's not CNA. CNAs can't renew anything. Put an X through that. All right. Providers can renew. All right. They must renew. All right. That's not providers CNA renew. No. A CNA can't renew anything, guys. Okay. Especially when it comes to restraints. It's providers can renew. So maximum of 24 consecutive hours, guys. So that means that you need to make sure that you look at the documentation. And if the nurse, if it's been 24 hours, he needs to come in, write another order. Because if it's 25 hours, that restraint needs to come off. Okay. So providers can renew. Okay. But that order is only for 24 hours. So if it's the 25th hour, he has not renewed that prescription, that restraint needs to come off. So remember that. Okay, that's a big deal, guys. Restraints are a huge deal. Okay, so maximum of 24 consecutive hours. That 25th hour, if that order is not renewed, that restraint needs to come off. Now, make sure that, remember, a restraint injury, restraint death, that's a sentinel event. Okay, so restraints become necessary to protect the patient and others from harm. So this is our highly agitated patient, our violent individual. And guys, believe it or not, our intubated patient has to be restrained sometimes because they try to pull out the vent. Okay. And suicide patient, guys. So this, make sure that your patient is falling under this criteria. We don't just use restraints for our convenience. All right. And if we are going to restrain someone, make sure you're doing your nursing interventions, which are your neurovascular checks, neurosensory checks. And if the patient has an order for restraints, Remember, he has an order for the restraint. Never leave the client unattended without restraints. Okay, especially for our suicide patients, guys, for our intubated patients. So never leave the client unattended without restraints. Okay, that's our nursing intervention. Make sure you're doing your neurovascular checks, your 5 Ps. And of course, what's very important is documentation. Okay, so client subjective and objective information. All right, so this is very important. Slide is very important. Okay, so before restraints, you want to document. During the application of restraints, after the removal, what were some behavioral interventions, and what nursing care did you provide? So when you have a patient who has restraints, these are the documentations. All right, this is what you need to document. What happened before you applied the restraint? What happened during? What happened after? What are some behavioral interventions? Did you provide music therapy? Did you do any type of they say diversion activities? What did you do to try to calm the patient down? What were some behavioral interventions that you implemented as a nurse? Music therapy. Sometimes they say aromatherapy. All right. And when the patient, when you apply the restraints, what type of education did you provide? What type of medications did you use? Therapeutic procedures that took place, diagnostic procedures that took place, lab values that took place. So you must document all of these things, the nursing care that was provided while the patient was in restraints. Okay, this is something that you must document. Okay, so enough about restraints. We beat that horse. Okay. All right. Now fire checklist. Okay. Fire, guys. Believe it or not, this race and this pass, it is on your exit. So you must know it. All right. So look at as many videos as you can. Look at as many Google images as you can. All right. Because it's going to be there. All right. This is one way we maintain a safe environment. Okay. So the first thing is rescue, alarm, confine, and extinguish. And under extinguish, guys, you have to know the different classification of fire extinguishers. All right. So class A, you see, like wood, paper, and then class B, flammable liquids, and then class C, electrical equipment. So this is a very important slide, believe it or not. It's a very important slide. So you must know about rescue, alarm, confine, extinguish. And also, guys, make sure that you research PASS. Okay? Make sure you research PASS. So this is how we keep the community safe through RACE and PASS. All right? Make sure you know that. Now, for your active learning activity today that I've embedded in your PowerPoint slide, okay? Later on, I'll add the link so you guys can retrieve these slides, but I want to show you guys real quick safety risk. Now, this is health promotion and maintenance developmental stages. Now, guys, it will be very beneficial to you for you to download this worksheet and do it. Health promotion and maintenance is a doozy. Okay, and I'll show you why. Let me show you why. Okay. So this is why. It should be populating soon on the screen. Okay, this is a worksheet, and I'll try to make it bigger. And I would recommend that you guys download this worksheet. The link will be in the description box. Okay? But this worksheet, this particular area today that we're discussing maintaining a safe environment. So health promotion and maintenance, and I'm gonna go a little slow. Let me make it a little bigger. Let me just make it a little bit bigger. Today we're just dealing with the last box, the injury prevention. All right, the injury prevention box. But I'm gonna scroll down and look at how many boxes that you are responsible for knowing. This is throughout the lifespan. So they're saying, Nurse Amy, nurse, how do you keep your patients safe throughout the lifespan? All right. Nurse Tamiko, how do you keep your patients safe? How do you keep a safe environment throughout the lifespan? So what I did, I made a exercise or a worksheet, and the first box, the first row is for our infants. How do we keep them safe? How do we keep a safe environment for the infants? It's through aspiration precaution. We tell the mommy to put the baby on the back. Water safety, suffocation prevention, poisoning prevention, falls and burns. These are all of the injury prevention tips, or these are all the environmental, safe environmental tips that we give this age group. So for each age group, you must, guys, and this is why health maintenance and promotion is so difficult. Okay? Because you are responsible for educating every age group. You guys see that? And for every age group, there's a different injury prevention teaching that you and I are responsible for. Okay? So I'll also include this in the link. And look, guys, we only did the last column. So you have to know, for health promotion and maintenance, for you to truly understand health promotion and maintenance, you basically have to do this entire worksheet. Okay, so I'll put it in the box for you. I'll put it in the description box for you guys, and you can download it. And you have to work on it. You have to do them, more than once. You have to do this worksheet at least 2 to 3 times, and then you'll understand health promotion and maintenance. All right. So back to what we're doing today. We're providing a safe environment for an injury prevention for every age group. Okay? So this is what you guys will get, and if you want it, you can download it, okay? All right, so let's go back to the slide. All right. So remember safety risk. All right. In order for you to truly understand safety risk, guys, in order for you to get that high mark on the exit, and in order for you to get that high mark on your NCLEX, make sure that you do this entire worksheet and do it more than once. Do it 2 or 3 times. But today we are focused on the injury prevention. Okay, so make sure that you guys read that. Okay, you can read that on your own. All right, it's there. I filled it out for you. All right, and we're almost there, guys. We're almost there. So, home safety plan. Okay, remember we're creating a safe environment. Okay, so the home safety plan, we have to educate the community. So, fire safety, guys. Make sure the patient knows about the fire escape plan. Everyone should have a fire escape plan in their house. Stop, drop, and roll, and make sure the fire alarms are working. Our carbon monoxide alarms should be working. Medication safety, TV and furniture, play safety, fall safety, and oxygen use safety. No one should be smoking around an oxygen tank. If a person has an oxygen tank, guys, and you as a nurse, you're going to their home, you need to ask them, where's your do not smoke sign? Where's your do not smoke sign? Okay, no smoking. They need to have signs. All right, so oxygen use safety. Remember, do not smoke. You need to have signs everywhere. And our ergonomic basic, guys, make sure as a nurse, in order for us to keep a safe environment for us and the patients, mechanical lifts, group lifts, guys. Don't attempt to lift patients on your own. And make sure that you enlist other staff. Maintain good postures. It says here, avoid twisting. Keep objects close to the body when lifting. Guys, just they want you to keep the object close to the body, bend at the knees, and make sure that you're using smooth movements. No jerking. All right, guys, that is it. I'll be here Friday at 9:30, and Friday I'll be covering facility protocols. All right, that's also a part of leadership and management. And after that, I'll go into some med surge and pharmacology starting next week. So I'm here every Monday at 9:30, every Friday at 9:30. We'll be finishing up the leadership and management, and then we'll go to some med surge and some pharm because I know everybody needs that. All right. I'll put the PowerPoints and the charts in the description box, and you guys can download it. All right. All right, guys. Well, thank you guys and good night. And I hope you guys enjoyed it. I hope you guys learned a lot. Thank you. Thank you, Tamiko. And I'll see you on tomorrow. See you tomorrow. Good night. See you, Ms. Winthrop. I'll see you Thursday. All right, Miss Johnson. Thank you for coming. All right, guys. Good night.